dental offices can reopen in Oregon starting tomorrow, and dentists nationwide are now preparing to go back into a very new working environment. Dr. Kevin Donnelly is the president of the American Academy of Pediatric Dentistry. He joins us live this morning to talk about what new precautions are being taken for when you will eventually have to take your kids back to the dentist. Doctor, good morning.
Good morning.
So I want to talk with you here about what precautions are being taken. I know we have a lot of Oregonians looking at their dental clinics that could reopen tomorrow, wondering when is it safe to go back to the dentist?
Well, I want you to know that there's just been a lot of safety precautions put in place as states begin to open their dental clinics, including pediatric dentistry clinics. And I know the American Academy of Pediatric Dentistry has gone to great efforts to develop what they call their practice checklist for re-entering your practice safely. States have done the same. Most of these are based off of the American Dental Association guidelines and guidelines from the Center for Disease Control and Prevention. And these are all safety precautions to make it safe for our patients, their parents, and for our staff.
You know, we've gotten a lot of questions from families here about dental emergencies. Parents wondering, what exactly is a dental emergency? Should I take my kids to the ER? Should I go to a dental clinic? So what should parents do? And yeah, what are those things that really you should not be ignoring right now?
Well, we categorize these in about three areas. One's trauma. If you take a tumble or bump a tooth and it breaks, you really need to see your pediatric dentist right away. If you have an infection causing a facial swelling or something like that, that really needs to be seen right away because it can affect, your overall health. And the other thing is pain, and some tooth pain can be really excruciating. And we need to keep kids out of pain, and that's an emergency to come in and do it. And you'll see the safety precautions I talked about earlier that are in place. People wearing more masks, more face masks, gowns, and things like that. Fewer people for social distancing to keep it safe for you during this emergency care and as we go on to treat non-emergency care.
Yeah, and I think that's an important distinction when we talk about dental emergencies. Families should be looking for an emergency dental clinic, right? And not just going to a hospital emergency room.
Absolutely. I'm glad you said that. We're trying to keep kids out of emergency rooms. They're overburdened already. We want to save those for the people that really need an ER physician and an ER nurse. So we want dental emergencies to come to our dental offices. Most of us are open for that. Or you can get online and find out the hours that they are available and get appointments.
So as far as those standard 6-month dental checkups, those regular cleanings, is that something families should be looking to put off right now? And if they do, how do we keep up on kids' oral health at home?
Well, as we go into non-emergent care, I think the first thing most dentists are going to do is take care of all that urgent care. We've been doing emergency care for 6 weeks, but there's some urgent care that really needs to be taken care of before it turns into emergencies. And from there on, then I think we are right around the corner from summer. And that's when you look at kids going to their pediatrician for their routine annual exam before school. The same thing with their pediatric dentist. So I think people can feel comfortable with our new safety precautions that they can go back for routine fillings and for cleanings and everything else with the new safety precautions we're taking.
Okay, we appreciate the updates, Dr. Donnelly. Thank you so much for joining us this morning, and stay healthy to you and yours as well.